Hello guys, my name is Monique and I'm the new from Brazil, DENEM. And today we're going to start our fourth webinar about the series about health system and medical education across the globe. And today we have Asia-Pacific as our region. And we have here India, represented by Pranav, Taiwan, represented by Linda and Kenneth, and Taiwan, represented by Jarupa. So I will start the presentation about the Brazilian health system, and then I give the word to our speakers. So I will share my screen now. Just a second. I hope you can see it now. So I will start. How is our system organized? In Brazil, we have the SUS, that stands for Sistema Único de Saúde, or Universal Healthcare System in English. It's public and absolutely free. And its principles are universality, equity, and integrity. That means that everyone in Brazil has the right to be assisted, like not only Brazilians, but everyone that is in Brazil. If you need an emergency, you get it for free if you go to the public hospitals. But like for the healthcare, like more basics healthcare, you need to live in Brazil to get it for free. But like if you need an emergency, if something happened, if you need to go to emergency, it's for free, like for all people, even foreign people. And they distribute efforts according to the local necessities of each region in order to provide an adequate support to every need. So if a neighborhood is more like they have more money, so people they don't need to use the public health, they will put this money that they don't need so much attention to the places that need more attention, that more people that use the public health system, so they get more attention because they need more. That's what they mean by that. And every person must be seen as a whole, owning the right to have all questions fully addressed. So if you go to the system with a headache, they not only will address the headache, but also they will do a full examination if you have something else that like is not your concern, but you also have to see by that. So they try to see the patient as a whole and not only about the symptoms. In order to do so, SUS is not restricted to the healthcare assistance. They also have a major role in articulations actions with other fields like educations and work legislations that ensure health promotion and prevention. The healthcare system is organized by three instances: national, state, and municipal authorities, and they're all responsible for making and managing and financing the assistance, which makes a joint actions. So all the three instances, they like part of the incomings, they must address to the health system. Like not all of them they put the same amount, but if a state needs more, healthcare systems they should put more money into the system for healthcare system. And the healthcare hierarchies is also divided as it is organized in three levels of systems. That is primary care, which is family medicine; the secondary care, that is ambulatorial, and this is clearly all specializations like cardiology, endocrinology, all specializations, and the tertiary that is hospitalization. That is only when like you need to go to the hospital when you're there, like in the hospital. So the primary system is organized in basic health units, we call in Portuguese UBS, that encompass the majority of the system extensions. So like here in the map, this colorful is like a city. So the city is divided into 6 colors, no, six colors, and in each of these colors they will have one UBS that will attend all the community in this area. So they have one UBS with many equips that have like a doctor, a dentist, a nurse, a community healthcare agents, and maybe some other types of assistants. Sometimes they have two. So they have a few teams with all this included, and they must attend all the community in this area. So in the red spot there, they have one UBS, and this UBS must attend all the families that live there. In order to do so, every city is divided into sanitary districts that have power to regulate their own primary health care, defining the distribution of UBS in the territory. One of the most important features of SUS is the popular participation, which means that everyone can and should participate in the system's decisions, taking the process. For that, we have health councils and conference that every person can take part despite the academic titles. So you don't need to be a doctor. You don't need to go to school. You just need to be interested on voting, on have a voice to participate in the decisions. And indeed, all communities should participate because it's for them. So one community, if they need more attentions, they need more dentists because people in this community don't have really good care of dentists. They will need to go to this conference and say they need more dentists because they are not attended by them. They're not enough to everyone, so they need to go and put a voice to speak and ask for the rights. In this way, everyone can help by suggesting strategies and controlling and evaluating the execution of healthcare policies since the UBS level and reaching to the national sphere. About medical education in Brazil, we have 6-year course that is divided in 3 blocks. So the first 2 years is the basic cycles that contemplate studies areas that are common for majorities of the health science course, such anatomy, biochemistry. In the 3rd and 4th year, we call it the clinical years, that is divided in the medical departments like cardiology, pediatrics, endocrinology, gastroenterology. So all this department we sit, and we mostly go to the ambulatory visits to have the first contact with patients. And in the last 2 years, we call internship. So we spend 2 years, the whole time in the hospital. We go to the hospital, also to the ambulatories, and in those 2 years, we try to see and be in the practice of all the areas. So we mostly go to pediatrics, gynecology and obstetrics, general surgery, internal medicine with all the subspecialties, public health, and some universities they also include rotation in mental health, or also some rural internship that they go to rural zones and attended as public health or something like that. I don't have it in my university, so I don't really know how it works, but some of the universities in Brazil, they have this program and it's really cool. And these rotations are not remunerated, so we don't get any payment for as we almost are a doctor without a stamp, so we cannot send patients home because we don't have a stamp to say, oh, you need these medicines, so okay, take away and take the medicines. But we are basically doctors without being doctors on these rotations, but we don't get any payment. Sometimes we even pay for that on the private schools, and it's obligatory for getting the medical degree. So you need to go to these 2 years of internships to graduate it and be a doctor. And each in the end of each specialty you pass, you also have exams, and that's it. That's our Brazilian part. So I guess Now, thank you for the attention. And now we are going to Pranab to present about India. Oh, your
Hi
turn.
everyone.
Hello.
Hi, thank you so much, Monica. That was a lovely presentation. And thank you for this opportunity to present our healthcare systems. I would be sharing I would be sharing my screen right now. Just let me know if it's visible. It is. Okay. Uh, so I would like to present the Indian healthcare system and also some views about the Indian healthcare system, which are mine, as per the 4.5 years that I've spent in the medical system, which is very little compared to the doctors and everyone spending years and decades in the medical system that we know all around the world. So, in India, the health is a state subject according to the Constitution of India. So, it is the responsibility of every state in our country. We have 29 states, and it is the responsibility of every state in our country to make efforts in raising the health standard of individual states. And this is also governed by the national, like the center, and they also provide health policies and everything regarding the medical system and the healthcare of the country. So the Indian healthcare system comprises of privately owned hospitals. Here we can see public and private, and the health personnels, medical colleges, program managers, and everyone and anyone. The healthcare system consists of all actions and individual whose main function is to provide quality healthcare services and to improve health status. So you can see, like in the public and private, we have the primary, secondary, tertiary, similar to Brazil. The private ones are profit and non-profit ones, which are the NGOs. And under primary, we have community health centers, primary healthcare centers, sub-centers. These are all distributed more away from the main cities towards the more uh, periphery. Then we have secondary, which are sub-district hospitals, and the tertiary, which everyone knows about, is the district hospitals with multi-speciality hospitals and the medical colleges. So here, the medical system of India has been developed after independence by following some things by the British government that we had before us. So we had to make a lot of changes because with a population of 1.4 billion, we are the second most populous country in the world. So providing healthcare for such a huge population was always been a problem since independence. Our national healthcare system is guided by the Union Ministry of Health and Family Welfare. And this is the ministry that is responsible for many health missions and everything. Also, as I mentioned before, it's mostly governed by the state, but the Union Ministry takes up stances about any thing that affects the entire nation. So the main problem with having 1.4 billion is not that there is 1.4 billion, but also that the majority of the Indian population lives in the rural areas and are below the poverty line. So, with this in mind, after independence, the first mission that the Union Ministry started was the National Rural Health Mission, because with having around 65 to 70% in the rural population, it's more garnered towards the rural population. So the health missions, which was NRHM, which is the National Rural Health Mission, the government focused on the majority of the Indian population, which is the rural population. So we had certain ideas because, again, how do you approach 1.4 billion people? So the main idea was to get people from the community. So we had brought up Asha, which is a accredited social health activist. She's a female health activist appointed in the region, in the small city, in the small village, which will be responsible for the health of the village. She will be the ones carrying out the mission's statements, like about to increase the to decrease the female mortality, to do any vaccinations which are there, any basic stuff which can be done has been given, the responsibility is given to the Asha, and she's given incentives to carrying out such things. An example would be if she is asked, if she gets a leprosy suspected patient to the hospital in time, she's given incentives. And it, depending on the stage when she's given, if she's brought it very early and she's caught it perfectly accurately, she is given more incentives. And she is also taught about the certain diseases that can be easily identified and brought. So this brings down the incidence of such diseases drastically. And as I mentioned in the primary healthcare center, in the primary part, we have sub-centers, PHCs and CHCs. Included Asha, the Panchayat, which is the head of the village, is given the responsibility to take care of the village. There will be frequent checks. They have to finish certain regulations and make sure that these regulations are followed in the village. So giving the responsibility means drastically going into a decentralized healthcare system, not having to sit on the top and monitor from top, but we give the power to the people and they are the ones who will be responsible for their health. This empowers them, builds up their capacity. And with the NRHM was integration of health and family welfare. So health as a whole was separate from family welfare until the NRHM. So until then, we had healthcare systems which were separate from the family. But now they realized like 1.4 billion people came up because there was no family welfare. So we started taking care of the family that we had and ensuring that each and everyone is given the healthcare that they deserve. In this, we had the Janani Suraksha Yojana and the Rashtriya Bal Swasthya Karyakram and multiple other programs. The Janani Suraksha Yojana is for pregnant females to get the vaccinations and everything checked up for free. Monthly antenatal checkups, postnatal checkups, prenatal checkups, everything is done for free. The Rashtriya Bal Swasthya Karyakram is for the children to be given vaccines and everything. This is all undertaken by the ASHA, which I mentioned before, the Panchayat, and these are the programs by the center to make sure that everyone gets it is similar on the pathway to universal health coverage. And after NRHM, the rural health population did increase a lot with the initiation of NRHM, but the urban population, which had previous access to good healthcare, because obviously the tertiary healthcare system is based in the urban areas, now faced a problem due to migration of the population from the rural to the urban areas, which led to crowding. And overcrowding brings with itself certain diseases because of the lifestyle changes that happen. To address this, the government began the National Urban Health Mission. This was more in frequency to how to address the uh, any diseases that can occur in the urban areas due to overcrowding, which in India and a lot of places around the world, tuberculosis is one of the main diseases in the tropical areas, and this is uh, intensified by the overcrowding nature of the urban areas. So there were a lot of missions to tackle tuberculosis, malaria, and any other thing that can come up during overcrowding. And eventually, the National Rural Health Mission and the National Urban Health Mission were combined to form the National Health Mission, whose diagram is based, whose image is put here. So after that, we had the Ayushman Bharat Yojana. We have had multiple, but the main one which I would like to talk about is Ayushman Bharat Yojana, which is very much into the aspect of universal health coverage. It aimed to provide free secondary healthcare and tertiary healthcare to the bottom 40% of the poor and vulnerable population. 40% of 1.4 billion people is a huge task, and there was a huge idea behind this to make sure that everyone receives healthcare when they deserve it, as they deserve it. It provides a cover of 5 lakh rupees, which is around 6,250 euros per family per year. And there is no restriction on family size, age, or gender. When you talk about when you this shows India's commitment towards UHC, and soon we will develop even into more aspects of universal health coverage. And now, after I've talked about how the medical system has tried to handle the overpopulation that we have, So I'd now like to talk about the medical education system. The medical education system in India is seen by the Medical Council of India, which is the MCI, and is governed by the previously mentioned Ministry of Health and Family Welfare. Medical schools in India produce the largest number of doctors than anywhere else in the world. Obviously, 1.4 billion people, you have 30,408 students. That's the latest update from 271 medical schools around the country. This is a huge number and not seen a lot in anywhere else in the world. But to get into such a medical college, you have to pass your entrance exams, which have a small requirement to have graduated at the 12th standard, which is anything before the college level, with biology as the main as one of the subjects to qualify for the exam. If you do not have biology, you do not qualify. The exam that we write is the National Eligibility Cum Entrance Exam, NEET exam, which has to be written in order to apply for a private or a government college. And we have about 1.5 million students applying each year. And this just increases with the population increase and people getting to know about what medical, uh, people getting more access to education and everything. Students usually vie for the coveted government seats in as private seats are really expensive. It can go up to around 170,000 euros per year, which might seem pale in comparison to a lot of uh, hospitals around the world. But you have to understand that India is a population. India requires these doctors, and if private hospitals do charge a lot, the stress to get into such a government college is even more. And after talking about how we get inside, how is the medical life? We have a medical life of 5.5 to 6.5 years. It depends on the state. So it is divided into preclinical years, similar to what Brazil has. The first 2 years where they study about what healthcare is, anatomy, biochemistry, pharmacotherapy, everything like that. Then we have the clinical years where they attend clinical postings, which happens usually in the morning, where they attend surgery or medicine postings. They visit the wards, they visit the OPD, they go to the operation theaters. This happens in the year 3 and 4. After this, as Monica said, there is internship, which is medical rotations, which happens for 1 year in different departments where, but luckily we do get paid for it. It varies from state to state. It varies from if you're in a private or government hospital, but we do get paid for this. It is essentially a doctor without the doctor tag. We cannot prescribe medicines. We are running around doing all the jobs and everything that a doctor can do. But again, obviously, we are learning about it. So it starts after year 4, and then we have this uh, thing called bond year, in which you are a doctor, but you have to compulsorily serve in a government hospital. This is usually seen in government colleges because of the intense subsidy that we get when we do our medicine in a government hospital. So it is a compulsory year we do as a doctor in a government hospital. And after this is our post graduation. Post graduation, for this we write uh, is one of the toughest to get because, as you can see, the total number of seats that we have in government is 14,000. Private is again a lot tough to get into, is a lot costly, and this includes the MD, MS, and diploma seats that we have. And the total number of applicants every year are around 200,000, which obviously increase because of the backlog of students that we have. So every year we get 30,000 uh, graduates from our medical hospitals, and when they apply for their post graduation, which is a specialization that's such as surgery, if they want to become a surgeon or go into medicine or so on and so forth, they have to apply for the next exam, which is the national exit test, which we will have soon. And it is one of the toughest to get in the world. And after getting it, it also is the toughest to continue working because, again, the patient overload is one of the hardest and the most in around the world. And the next exam is what will be initiated in subsequent years. It will involve both clinical and theoretical skills and knowledge. So the entrance exam will judge you based on your clinical skills and your theoretical skills. This would be happening soon in the next 2 to 3 years to bring it in line with what USMLE and other international exams do. So now I've talked about how all the medical system is. It is a very small and very compressed format that I have followed, but I hope you had understood like what all are the issues that we have and how the government is trying to tackle these issues in India. The main problems that we have always had is overpopulation, which brings its own set of diseases, and it provides a huge strain on the dwindling healthcare services that we have in India. And also in India, there is especially in the rural areas, there is a reliance, an extreme reliance on superstition and traditional therapies. Uh, with this, they tend not to accept the scientifically proven healthcare system, but work on what their elders used to tell them about certain things. That could include from various methods to get a boy is also what something people do, or applying certain plants or small spices to reduce the inflammation or something like that. A lot of these things are done, which leads to finally they ending up in the hospital because of following certain superstition or traditional therapies, which are not proven and which can elicit or intensify the irritation which is there. And also, this all stems from the fact of lack of education, because again, being in the rural means 60% of the population is in the rural, where sending all these services that we have is again tough to get. And with the 1.4 billion, which is the main problem, again, we also have so when you have lack of education, you the second step, which is reliance on superstition traditional therapies, intensifies, and the cycle follows because people do not get educated. They continue to do so by relying on whatever their elders used to tell them, and the healthcare system dwindles, which they are not able to study because of poor healthcare, and the cycle, which is a vicious cycle. And in addition to this, which is lack of infrastructure, which is again, as you have seen, we have 30,000 students, we have the largest number of doctors ever possible, but that is still not, that pales in the comparison to the population that is there. So I do not know the actual ratio of doctor to patient, but I can assume it is pretty large. The pandemic also has shown how every country's healthcare, not just your own, but you can also see how every country's healthcare system is equipped and how adamant their citizens are. So it's not necessary sometimes that just education, being educated is enough. It's also how the culture is there, because again, it's an iceberg. Culture is something that you cannot just see on the oversee, but you need to go into what is the actual problem within society to understand their problems and to get to the root of the problem. And I've spoken about these as problems, but now I'll just move on to like the positive side of what medical systems in India offer. The private hospitals in India and also some of the government hospitals in India provide world-class quality healthcare. A lot we have had a lot of we have something called medical tourism, where a lot of tourists come to India to get the healthcare that we have because it is at a fraction of the price of hospitals in developed countries. And the doctors which graduate from government hospitals are, I don't know if it's a good thing or a bad thing, experience immense patient overload. And due to this, they are one of the most extremely experienced in the world. And medical education in India is one of the cheapest if you do get lucky to get the government seat, and if you are one of like the top, because again, the competition is so high that the people who get or graduate from a medical college in India seem to be the best. And I would like to end my conversation by saying with this, and I hope I hope I've been able to tell you about how the medical system in India is. And please let me know if you have any questions. I would be going through the comment section. And I do not see any.
Uh,
Thank you so much.
I guess we'll have questions at the end
Okay, perfect.
because we have a form.
Okay. Thank you so much.
So thank you for your presentation. It was really nice. It was really, really great. And we will have the questions at the end. So now we can go to the second country. I don't know if it's Thailand or Taiwan or Thailand.
All right, I will go
Going to the
second.
second. So Jarupa is going to be represent Thailand as now. So we can start. Thank you.
All right, can you see my screen now, guys?
Yes.
Hi. Hi, I'm Jarupa. I am a fifth-year medical student in Thailand, and I'm studying in Rangsit University. I am now representing IFMSA Thailand. So I'm going to talk about the medical education in Thailand first. So in Thailand, if you want to go to a medical school, you can go straight away from high school to university. So when you apply for the medical school, you have 6 years of studies in total. So, in Thailand we have two different types of university in Thailand. We have the government funded one and then the private one. So the government funded university in Thailand, it costs you less. It probably costs you less than $3,000 per year, or it's even free in some countries. But except for some international programs, and also I am in a private one. So my university is Rangsit University. It is a private university in Thailand. So it would cost me roughly around $17,000 per year to study in private university. So what do we have to go through when we are studying in medical school? So the first year to the third year, we are studying with lectures, and after we finish our third year, we'll go to another. We will have to take the national license exam one, and if we pass it, we would go on to the fourth year and the fifth year. And when we finish our fifth year, we have to take another exam. It's called national license number 2. So if we pass it, we will go on to our 6th year of study. And before we get our degree, we have to pass the national license number 3, the third one. And if we pass all of that, national license number 1, 2, 3, and we pass all the subjects in our school, we are now a doctor. But we are not a specialist. We are just a general practitioner. So what do we have to study during those 6 years in medical school? So the first to the third year of our medical school, we basically study cell biology, physiology, and pathology of anatomy. We study English for medicine as well. We also study mathematics and physics, and we study biochemistry and pharmacology. And the fourth year to the 6th year of our studies, this is when we started to work in the hospitals. So we have to do rotations in various departments in the hospital, and we tend to spend a lot of time in each department just to learn how they work, to see the differences between each department. And we also learn to see ourselves whether we like this department or not, because after we finish our 6th year, we have to decide whether we want to pursue this specialty or another specialty. And also we have a community medicine. Community medicine in my university is like a trip outside of the city. So we basically go outside of the city, and then we live with the locals, and we live with our friends. And every day we would have to provide health promotion to the locals. And I think it's very it's like a relaxed trip for us medical students to just relax and have fun and learn how to communicate with other people as normal person, I think. And also we have elective programs. this is also good for us because whenever we have free time, for example, we have vacations, we can also choose to stay home, or we can choose to apply as a student to work in another hospital rather than in our own hospital, so that you can present yourself there. So if you, especially if you want to study, if you want to work in another hospital that you, when you graduated, you can go to that hospital and then you present yourself as a hardworking person, and maybe they will offer you a seat to work there after you graduate. And we also have to do at least one research in our school, and also we have a very interesting system, is that we have hands-on experience with the patients. We get to do everything with the patients, and also we are having night shifts as well as a student to learn how to be a doctor in real life. And we also have external rotation in rural hospitals. This one is for 6-year students. So they would go out to another hospital in rural areas, and they would have to work on their own, and it's going to be a little bit difficult for them because normally they would be in the city and there are more staff, more residents, more attending for them to consult. So when they go out of the city, they will have to be more independent, and it would help them to learn how to survive in a real world. So I'm going to talk about how to become a specialist in Thailand. So as I told you, there are two different type of university in Thailand. There's a private one and there's a governmental university. So I'm going to start the private university that I'm in. I have two choices after I graduate. So the first choice is that I go straight to the free training program. Or the second choice is that I can enter the lottery method. I know it sounds funny in English, but the situation is this: is the lottery method is like after the 6-year students graduate, they would come together in one place, and they would have to choose one hospital that they want to work in the future. So they would go to that hospital, and then they would just put their name down under the name of the hospital. And if there are more people than the hospital can accept, they would have to randomly pick up the names. So if you get lucky, you will be working in that hospital that you chose. But if you're not that lucky, then you have to go to another hospital that are still available, and they will have to pick up your names again. And after you get a place to work, so you are now an intern. So the way to become a specialist as an intern is that you can continue working in that hospital, and after a while you can ask the hospital whether they can send you to study specialty, or you can enter the free training after you don't have any contract with the government. So what is the contract that I was talking about is that if you are studying with governmental university, when you started your medical school, they will have you sign the contract that says something like, if you finish your 6th year of study, you have to work in a public hospital for at least 3 years or so. It depends on each contract. So for governmental university students, they would have to go through the lottery methods, most of them. But there are some people who don't want to be randomly picked up by the names. They can just choose to pay the money, and then they would go straight to the free training programs. But I would say that the free training programs in Thailand is not very easy to get in because it is very competitive. So I'm going to talk about Thailand's healthcare system. So in Thailand, we have a very interesting system that we implemented from WHO. We have already implemented universal health coverage since 2002. So it is like 18 years ago now. So in Thailand, we have 4 types of insurances. So the first one is UCS. UCS is a universal coverage scheme. And the second one is the social health insurance. The third one is the CSMBS, which stands for Civil Servant Medical Benefit Scheme. And the fourth one is USAP, is a universal coverage for emergency patients. So let's see more. So to know better about these insurances, you have to know where you belong to. So I'm going to start with the social health insurance first. So if you are in this group, you are someone who works with the private sector, or you are an immigrant who works for someone, or you have a company, or you work for a company, or you work for someone, then you are in this group. It's SHI. And the second one is the CSMBS. This one is for the people who work with the government sector. For example, if you are a police officer, doctors, nurses, teachers, soldiers, then you are in this group. What about us students? The students or the rest of the people who are not included in these 2 groups are in here. It's called Universal Coverage Scheme. This one is for everyone, and also for some immigrants who doesn't work for someone, so they are in here as well. And the last one is USAP. USAP stands for Universal Coverage for Emergency Patients. So this one is basically for everyone. I'm going to talk more in details after this. So what are the differences? So first, when you want to know when you want to know which hospital you would have to get treatment, at the beginning they will have you choose one hospital for you to get treatment. For example, I am in Bangkok right now, and I chose the hospital which is nearest to my house to be my registered hospital. So when I get sick, I have to go to that hospital to get free treatment. But if I'm traveling somewhere else, let's say another province in Thailand, and I get sick, and then I go to the hospital in that province, it will not be free. I will have to pay for the treatment. And the social health insurance for immigrants and private sector people, they also have to go to the registered hospital as well to get free treatment. But the special, what's special is this group of insurance. This insurance is for people who work with the government sector. So in this insurance, it provides such convenience for people who belong to this group, because if they get sick, they can go to any hospital in Thailand, whether it's public one or private one, for outpatient department. But if they want to stay overnight in a hospital, they have to go to the public one. But I think it's very convenient than other types of insurances. And also, the CSMBS also provide annual checkup as well, while the rest doesn't provide any annual checkup. And family planning and services, antiretroviral therapy for HIV or AIDS, or vaccines and screening tests are all provided in 3 groups. Cancer is a little bit tricky, because UCS and CSMBS also provide, it covers cancer therapy. But for SHI, this kind of insurance only covers treatment for cancer if you have the cancer after you get the insurance. So if you already have cancer and then you started to get insurance at that time, it will not be covered. And also there is referral transportation. The universal coverage scheme provides all kinds of transportation for you. So you will be transported in by car, by plane, or by sea. But the CSMBS only provide you the transportation by car. So there are benefits and also downside of each insurances. So which leaves me the last one of the insurance in Thailand. So it's called universal coverage for emergency patients. So this type of insurance is for everyone. It's free of charge. And if you have any of these symptoms, you can go to any hospitals in Thailand. So if you are unconscious, not breathing, or you have tachypnea, wheezing, or you have acute chest pain, or you have super sweating or hypothermia or seizure, or hemiplegia, speech difficulty, or continuous seizure, or you have other symptoms that involve respiratory, cardiovascular, or central nervous system, you can go to any hospital and you will be treated for free. But you will only be treated for free until 72 hours, and then you will be transferred to your registered hospital, as I first talked about. So if you get transferred to your registered hospital, the cost after that it will also be free. But if you refuse to get transferred, you will have to pay for the rest of the treatment. So there are a lot of benefits to the healthcare system in Thailand, but there are also challenges. The first one is the lack of information, because a lot of people in Thailand, they don't know where their hospital is or where they have to go to get free treatment. So we have to fix on that as well. So the second one is the population coverage, because there are some people who got left out by the system. For example, you are an immigrant who just came to Thailand, and you have to buy the insurance to get treatment in Thailand. While you are waiting to buy the insurance, at that time you're not covered. You're not covered to get treatment. So that is the pitfall that we have to see through, and also the inequity. In terms of the medical service in each groups of services is very different, as you can see. So SSI, they're not gonna cover cancer for you. They're not gonna have annual checkup for you, and also UCS, they're not gonna have annual checkup for you. So it's very different, and for people who are in a SHI group, they pay more in terms of the general taxes that they have to pay. They also have to pay extra from their income to have this kind of insurance. So I think it's a little bit unfair for them to not having received every kind of treatment that they should have. So the last one is the financial burden. So we have the very good system in Thailand to access healthcare, but there are also downside of it, because people tend to think that they can just go to the hospital whenever they want to get free treatment. So they tend to not look after themselves. Like if they have only a bit of fever, then they just go to the ER room. And I think it's not necessary for them to go. They can just wait to see if the fever would subside or not. So this is such a waste of time and waste of our medical staff. So I think I'm gonna finish this session with by inviting you to Thailand. So we have Score and Scopy in Thailand as well. So this is our Instagram, Scope and Score Thailand. So if you want to see what it's really like in Thailand, then you should come to Thailand. Thank you for your attention.
Thank you, Sherpa. It was really amazing presentation. I love it. Thank you so much. And now I guess we can go to our last country, Taiwan. With Linda and Kenneth.
Yeah.
Hi,
Wait.
guys.
Yes. Do you guys all see that?
Yes.
Hi. Yeah. So hi everyone. So I'm Kenneth from Taiwan, and today Linda and I will be talking about the health system and the medical education in Taiwan. So Linda is new out this season or this annual, and she's a fourth year medical medicine student in Chang'an University, while I'm the next neo out, and we'll be studying third year in Taipei Medical University. So today we're going to talk about we'll first have a brief introduction of Taiwan, and also to talk about the medical education in Taiwan and ways to get into medicine in Taiwan. And then Linda will talk about the licensing exam and also the national health insurance. So I would like to know how much of the participants know about Taiwan. So there's the world map. So do you know where Taiwan is? Taiwan is actually here, a very small island, which is near China, Philippines, and Japan, which is in the Asia-Pacific region. So can I have some keywords from the participants about Taiwan? So what do you know about Taiwan? You can type it in the YouTube comment so I can see that. So for Taiwan, I would like to introduce it in the 5 different aspects. So actually it's in the Asia Pacific, and maybe some of you have been mentioning about the food. Maybe you know about the bubble milk tea, which is actually originate from Taiwan, and it's also spreading to the whole world. So I'm not sure whether Brazil had bubble milk tea, but I know many places have the bubble milk tea shop. While we also have our highest building, the Taipei 101, which is 101 floors, which is the highest building in Taiwan. And we are also the host of the August meeting 19. So maybe some of you have been traveled to Taiwan due to attending the August meeting last summer. We also have 18 LCs, but some LCs share the same university because some university may have different medical degrees, which I will be talking about in the later section. So I'm going to go into the topic, the medical education in Taiwan. There are actually 4 types of medical education, or 4 types of medical degree in Taiwan: the basic or the Western medicine, the Chinese medicine degree, the post-bachelor medicine degree, and the post-bachelor Chinese medicine degree. Which the medicine degree requires 6 years of study. The Chinese medicine requires 7 years of study. the post-bachelor medicine requires 4 years of study, and the post-bachelor Chinese medicine requires 5 years of studies. So actually, most of you maybe know about the medicine degree. So the post-bachelor degree one will require the students to already have a degree on hand, which is something similar to the States. While for Chinese medicine degree, the extra year is for the Chinese medicine degree students to go for Chinese medicine clerkship. While they actually have similar syllabus with the medicine degree students, but they will learn more about herbal medicines, acupuncture, or different aspects of the Chinese medicine. So that the Chinese medicine degree students have a heavy loading on the course and credits their medicine degree because they have a shorter period of time, but more courses or credit to take. So this situation also applies for the both bachelor Chinese medicine students. So I'm going to talk about the courses in different medical degree. So for medicine and Chinese medicine degree, the first year and the second year will have general education such as sports, music and arts, humanities, etc., and also basic science such as basic physics, calculus, analytical chemistry, organic chemistry, and also biochemistry. In second year to third year, we'll start our basic medicine courses such as microbiology, or also we'll have immunology, physiology, anatomy, etc. In the third year and the fourth year, we'll have our clinical medicine courses. After the fourth year, we'll start to have our clinical practice. While for Chinese medicine students, they will have the clinical practice for 3 years, while for medicine students, they will have the clinical practice for 2 years. After 6 years of studies and after the clinical practice, students are graduated and they will enter the post-graduation year stage. So in Taiwan, there are 2 types of introducing basic medicine and clinical medicine method. So some school will use the block method, which teaching students by human systems, such as the musculoskeletal system, the respiratory and circulatory system, digestive system, etc. While some schools will teach by subjects such as anatomy, physiology, etc. So for students having the block system, they will be like closer to the clinical field because physician also see patients by systems. While for students not using a block system, they may learn faster because knowledge are not mixed at once. For post-bachelor medicine and Chinese medicine students, they don't have general education and science courses, or only a limited courses are provided because they already have a bachelor degree in hand. So they'll directly start the courses from basic medicine and clinical medicine courses, which also take, for post-bachelor medicine, they take 2 years, and Chinese medicine also for 2 years. For clinical practice, both post-bachelor medicine will have 2 years, and post-bachelor Chinese medicine will have 3 years of clinical practice. Then they will enter the post-graduation year. So they're almost similar, but they don't have the general education and also the general science courses. So ways to get into medicine. In Taiwan, there are actually three ways to get into medicines, which is a very complicated system, but I'll try to explain the things in a simple way. So students can go into medicine by school nominations. If you ranked first or second in your school, you can apply for the school nominations program, and then you receive interview from faculty and from different universities. But most of the desired degree. So maybe if they fill in medicine, they mostly can go to the medicine degree. Around 70 to 80% of students will succeed by their school nominations. So some secondary school students who would like to attend a medical degree will choose a less competitive secondary school so that they can be ranked first or second easier. Well, for most students, they will enter the easier test. The easier test is score the full mark. The full mark of the easier test is 60 marks. To get into medicine, you have to score around 59 or 60. After you got 59 or 60, which is the basic requirements, the real elimination part will be within the interview. So because there really are many students who can get 59 on 60 marks, so university will select students based on the interview performance. So if students are not selected in the easier test with interview, so they're not attained a degree, or they are not they're not satisfied from the results, they can go to the harder test. So the harder test only based on score calculation. So there will be no interview for students. So if you score higher mark, you can go to better degree. Well, for others, some university will also offer unconditioned offer to students who have very outstanding performance in competition or international competitions. Also, foreign students will be able to enter medicine by interview or other ways. There are also three types of special degrees: the normal one, and the government subsidized one, and the military subsidized one. So the normal one is just the normal one, so there's nothing to explain. The government subsidized one is that students are subsidized by the government and they've been paid for the school fee, and they also get subsidy for their daily living during their studies. But after the graduation, they cannot select the specialty they want, or they only can select the limited specialties. And also, they cannot select the training hospitals, which most students would like to train in a famous hospital, but government subsidized students cannot choose their hospitals. At last, after they have their attending physician license, these students have to serve in the rural or remote area for 6 years, so that they've got subsidies in the university, but they'll have to pay back or have to sacrifice their freedom at the later age. For military subsidized, they are similar to the government subsidized. They also have waived the school fees and have salary during their studies, but they will have to go to troops or military hospitals after their graduation. So the options have it's also been limited. So this is a brief introduction of the medical education system in Taiwan. So it's now for Linda to talk about the license exam and the universal health coverage.
Hi. Hi, can you guys hear me? Hello.
Yes.
Yes.
I want to apologize because my computer does not have a camera, and I think it's broken or something, so I have to use my phone. And I would like to ask Kenneth to help me to change the PowerPoint page because due to the machine's issue. And so, hi, I'm Linda again. I'm going to continue to talk about today's topic from the doctoral licensing exam. Next page, please. Okay, so how many big exams are there to become a doctor in Taiwan? After you are enrolled in med school, besides having good grades at school, you have to prepare for licensing exams held by the government. I've once heard about the situation in Malaysia, and one of my friends which is a Malaysian medical students. He said to me that they don't have licensing exam. It's total shock because like there are 2 stages of the licensing exam, and students have to finish the first one in order to take the second one 2 years later. And normally you have 2 chances to pass the first stage. And this stage is about basic medicine, for example, like immunology, anatomy, pharmacology, biochemistry, etc. And after graduation, students will take the second stage. But before that, in the middle of the 6-year study, we have to take OSCE, Objective Structure Clinical Exam. OSCE is about basic clinical skills, and the second stage of licensing exam is about clinical medicine knowledge. Second stage's exam is to get doctor license, and by passing those 3 exams, we can apply for postgraduate year study. We call this part of study PGY, just like internship in a hospital, not fully authorized to practice medicine, but still can do something. And after this PGI, we can finally choose our specialties to join residency program. Depends on the specialties you choose. It takes 3 to 6 years. After the last year of residency, we call it CR, Chief Residency. We have to take 1 more exam to get specialist certification to finally become a regular doctors. So a little bit complicated here. Next, I'm going to talk about national health insurance. It's our presentation's last part. Unlike Thailand, when it comes to health insurance, basically there is only one kind of insurance which is NHI. And next page, please. Okay, so and before we're going to talk about that, this is Ministry of Health and Welfare in Taiwan. As you can see, it is responsible for the administration of the public health system, social welfare, affordable and universal health care, hospitals, pharmaceutical disease prevention, supervision and coordination of local health agencies in Taiwan. So the point here is about affordable and universal health care. We would like to talk about how they do that. What is our government's policy to achieve this goal? Next page. Thank you, Kenneth. It is NHI, National Health Insurance. It was launched on March 1st, 1995 to safeguard the right to health care of all of the country's citizens. It is compulsory for all citizens starting from birth. It is founded on the concept of mutual assistance and depends on the insured paying their premiums according to regulations. Next page, please. And just like some other kinds of health insurance, when people fall ill, the government, as a single payer in the idea of payment system, uses the premiums it receives to help patients pay part of their medical and medication costs to contracted healthcare institutions. In this way, when we are ill, we can obtain appropriate medical care for a reasonable sum of money. In other words, next page. Okay. And by paying your monthly national health insurance premiums on time, you are not only helping yourself, but also are receiving help from other premium payers. And when others become ill, they will also receive help from you. And it's a very important point that, next page. NHI requires compulsory enrollment. It means it is compulsory social insurance program. By law, every Taiwanese citizen with official residency or foreign national living in Taiwan with an alien resident certificate, ARC, regardless of age, gender, and employment status, must enroll in the program. Also, this insurance program lasts an entire lifetime. No one may arbitrarily withdraw except for those who lose their insurance eligibility, such as people who give up their Taiwan citizenship, maybe immigrants or something, move abroad, let their alien resident certificate expire, or a person who goes missing. Next page. Because it can be categorized into compulsory social insurance, it has several, actually 3 characteristics. It can cause income redistribution and avoid adverse selection. And the main purpose of insurance, of course, it should be risk sharing. and it might and usually cause intergeneration transfer. But now I'm not, and definitely not going to teach health economics, and I'm not going to talk about this. So about these issues, we are going to stop here. Next page, please. And one thing I would like to talk about our national health insurance is the NHI card. And when individuals enroll in the National Health Insurance Program, they have to apply for a National Health Insurance card. The card is a proof that the person enrolls in National Health Insurance Program, and it must be presented every time you visit a clinic or hospital. It looks like an identification card, and it can somehow use as an identification card. Next page. Yeah, it looks like this. On the left side is a model of NHI card, and citizens and foreign people with alien resident certificate have to bring this card with them basically all the time, just as they do to ID card. And especially when visiting a hospital or applying for government documents, going to the banks, etc. And I know it looks like it looks a little bit outdated, old-fashioned, but it just has been used for 20 more years. So I don't know when will the government change the style or just this card. It's, yeah, to me it's a little bit ugly, honestly speaking. And on the right side is a smartphone app I would like to show you. It is launched by our government, and it can be used to track individuals, basically oneself health records by entering your ID number and some other personal information. Getting into the homepage on this app, we can see the previous diagnosis, medicine usage, even those lab results come from the hospital. And through this app, you can also find the nearest hospital or clinic of your accommodation. And about this app, I would like to share one more thing is the Ministry of Health and Welfare have once used this app to manage the sales of masks during the pandemic time, and just about 2 months ago. They asked every mask producing company to hand over those masks to the government, and once they are made. And because Taiwan is highly populated country with dense living people in every city, so there are actually plenty convenient store. If you have ever visited Taiwan or Tokyo, Osaka, maybe Seoul, you would understand how dense it is those convenience stores are. The government asked the drugstore, convenience store to help delivering and selling those surgical masks during this pandemic time. And these three icons are just those convenience stores are mostly common things in Taiwan. Last page, please. Next page, sorry. And last but not least, one of the reasons why Taiwan is well known for its health system is because of its payment system. And there are three main ideas: global budgeting and DRG's diagnosis related group, and the other one is in translation is denying the coverage. And what does those mean? Global budgeting is just as you think, and there are only a fixed amount of money each year can be paid by the single payer, which is the government, to the hospitals and doctors as medical expenses. And about denying the coverage, it's a little bit complicated because if doctors do something more than what is expected to treat the disease or patient, the government would just simply deny to pay for those extra fees due to the practice, which means hospital won't getting the reimbursement from the NHI, National Health Insurance, of those extra medical practice. And DRG as diagnosis related groups is actually one kind of prospective payment systems. A prospective payment system is one in which the healthcare institution receives a set amount of money for each episode of care provided to a patient, regardless of the actual amount of care used. And DRGs actually are assigned by a group per program based on ICD diagnosis, procedures, age, sex, discharge status, and the presence of complication or comorbidities. DRGs has been used in the US since 1983, so basically we are just copying their systems. And to determine how much medicine pays to the hospital, since patients with each category are similarly clinically are expected to use the same level of hospital resources. But just and yeah, there are actually more topics and characteristics about our NHI payment system to talk about, but due to a lack of time, I think we will just stop here. And oh, just to clarify, in order to cause unnecessary waste of medical resources, actually, when people fall ill to come to hospital, they still have to pay a small amount of money to get treatment. And that small amount of money is not too much, and actually most of the payment will be covered by the government. But some other like plastic surgery or unnecessary medical use or some other advanced medical treatment, like maybe some advanced cancer therapy, we still have to pay by ourselves. Yeah, it's not covered by the NHI insurance. And thanks for listening. It's just for today. And Taiwan touches your heart. Yeah. Thank you.
Thank you so much for the presentation.
Thank you, Jonathan.
Sorry. You can go.
You had me.
Okay. So thank you for the presentation. It was really amazing, all of you. We're very proud of this initiative and thank you for supporting us. So we are sending out the questions that we received in the forms. The first question is to Pranav. Is writing here, so I will read and I will probably put in the screen too. I'm wondering if you could comment on how much Ayurvedic, I don't know how to pronounce it, medicine is in your curriculum at your medical school. Is it integrated in your course?
Hi, thank you for the question. Ayurveda is an old science of healthcare, similar to how Chinese medicine and other healthcare systems in ancient, like in the olden times, it used to be. It is not in the medical, in medicine, like what I study. I would not be studying Ayurveda, but there are other branches of healthcare which is comes under Ayush, which is Ayurveda, yoga, naturopathy, Unani, Siddhi, and homeopathy. So this is a different branch. And now the idea is to make it more clinically and scientifically possible, like plausible, by the government has employed research programs to find out the legitimacy and to make sure that these are actual legit uh, ways of treating a patient, because also this reduces the strain on the medical healthcare. So if you can have naturopathy or natural health products to reduce small infections or small inflammations by natural products, that might very much help us medical in the medical field. So we have Ayush and we have the medical and the dental fields. And but I do not study about it. I think they might be integrating this in the future with a new change in the medical culture.
Okay, thank you. Next question is to everyone. Does your medical school curriculum have any course on the planetary health and climate change? Anyone can go first.
I'm gonna answer for Thailand. I don't think in Thailand we have these courses, so sorry.
Yeah, I think it's same
Uh,
for Taiwan. We don't have much for that.
okay. In India, it's not so much, but we do talk about it in our community medicine for global health. We talk about how to address the certain ideas, because a lot of our cities are coastal lined, so it makes sense that global warming would affect these cities. So we do address it some way or the other, but not so much in detail.
Thank you. Next question is to Pranav. How difficult is to enter in the medical school in India?
It is tough. It is. it is tough, but at least like when I heard about the lottery system which is there in other countries, that at least it's not there for us. It's a rank-based system, which again everyone has to prepare, and a lot of people prepare since they're around 4 to 5 years before they write this exam. So they try to prepare. They start preparing for that. They have coaching classes. It's a huge industry in our country for medicine and engineering. So you can understand how difficult it
Oh,
becomes.
cool. Next question is for Kenneth or Linda. Do most of the students choose the Chinese method?
I'll be going to answer that. So, as far as I know, most students would rather to choose the Western one, and in some of the faculty or program, actually, students can get both the Chinese and the Western medicine license within the 7th year, but most of them at the end will go back to the Western one. So the Western method or the Western medicine is somehow more popular within the Taiwan population.
Okay, perfect. Thank you.
Oh,
Sorry, Linda.
each year we have 1,300 medical students to get enrolled in medical school, and among them there are only about 300 students will choose the Chinese methods, and basically some of them can get 2 licenses at the end of the study, but they finally can only choose one as their career. They can be a Chinese medicine doctor or the Western medicine doctor at the end.
Okay, thank you. Next question is for Jarupa. Thank you for your presentation, Jarupa. It was awesome. I'd like you to know if medical students are paid during their 4th or 6th year. And can you explain a bit more about the free training?
Thank you for your appreciation. So about the payment during the 4th to 6th year, unfortunately, we don't get paid. Even though I wish we would get paid because we also work like a doctor, and also I think it's very exhausting in Thailand to be a student because you also have to study and also have to work, and you have to do everything the resident said, like running the labs or drawing the blood from the patients or like cleaning the wounds. It's everything. It's very exhausting, and I wish we would get paid. And about the free training, it's like a fast track for you to become a specialist. So you don't have to work in a public hospital first after you graduate, because I think it's free training thing is very competitive. It's very difficult to get into. So you need to have connections. As I said, that you would have to do like an elective program in another hospital during your study to represent yourself, to show yourself that you are hardworking, and you have to have these kind of connections to get into free training program, because that the connections is the most important things about the training program. But if you are an A straight student, then it's gonna be a little bit easy for you to get to the free training program. And also, I think I'm gonna explain more about the governmental university. As I said, the people who are studying in governmental university, you have the contract with the government. So when you finish your degree, you cannot just go through the free training program. You have to work for the government first, then you can be free after that.
Okay, thank you.
Yeah.
Next question is to everyone again. Is it common in your country to have foreign students in the medical school? Someone?
So
I'd go. Sorry, go ahead.
also, actually, I'm one of the foreign students. So I'm actually not from Taiwan, and I'm from Hong Kong. So I'm one of the representative of a foreign student. Actually, Taiwan receive around 10% of overseas Chinese students as foreign students. So what actually means for overseas Chinese student is that maybe the parents are Taiwanese, but they move to or immigrate to other places like the state or other places, and they come back and they send their children back to Taiwan for tertiary education. So they somehow defined it as foreign students. For Hong Kong and Macau, due to political and history issues, so they also counted that as foreign students. And also due to history and political issue, China student is not allowed to have medical courses or Chinese medicine courses in Taiwan.
And there are only one school to they are fully admit other countries students. Like most of our foreign students is from, just as Kenneth just stated, is overseas Chinese students. We seldom see like maybe Japanese or some other foreign country students will be enrolled in medical school in Taiwan. I guess the government won't allow foreign students to get enrolled in Taiwanese medical school. And we have one LC. They don't accept Taiwanese students. They only accept foreign students. But it's not really common to see other foreign students in Taiwan, and it's just in Taiwan. And thanks.
Thank you.
For Thailand, we don't have foreign medical students in Thailand, but we do have scope and Scopy exchange students here in Thailand. Does it count? But I don't know. So we don't have actual foreign students in Thailand, but we do have foreign student Thai people who went to study outside of the country and then they come back to work in the country. We do have this a lot. Yeah.
In India, we have two quotas, which is like two branches of foreign students. One is non-resident Indians. Those are people not staying in India but wanting to study in India. They have a different set of seats which are made available to them in private colleges. And we have for foreign medical students another private group of set of seats in private colleges. Only few government seats are available for for foreign medical students, and all of them have to write the common entrance exam that we all write, and then wait for the turns.
Thank you. Next question is for Kenneth and Linda. What is the most popular medical specialty in Taiwan?
So actually, the most popular medical specialty will be dermatology and maybe
For ophthalmology.
optometry.
I'll go for ophthalmology.
Yeah, so
They are both popular actually.
not the one like not the surgical or the internal.
Yeah.
Oh, yeah, so
Or maybe ENT,
actually
plastic surgery or something.
those very
Oh, you can go first. Sorry, Kenneth. Oh, you. Oh.
sorry, not. Yeah, so what we have said, not those very like very big one will be very popular. Will count as so the small specialty like the dermatology or optometry, etc. So or EMT. Cause in Taiwan we are afraid of having like being sued to the court. So people choose those with less risk and also people would like to choose those with more regular working hours and don't have to have shifts. So not so people would not like to choose like internal medicine or surgical departments. And also for pediatrics, as there are less child in Taiwan now, so I think it's the same problem within the world. So like due to economic considerations, there are not less people are going to choose pediatrics also. So these are those departments that the government subsidized that student has to choose.
Okay, thank you. Next question is for Pranav. Is the healthcare free in India?
Hi. As I mentioned, the healthcare in India under Ayushman Bharat Yojana, which is a health scheme, is free for 40% of the Indian population, which is below, like at the bottom 40% of the Indian population. For the rest, they have to pay, but again, it is extremely subsidized in a lot of ways under various health schemes.
Thank you. I don't know if there's one more question then. To Pranav, I would like to know how the castle system affect the healthcare system. Do you have situations where health professionals don't want to see or treat patients that are from lower castle? How does it work in real life practice?
Hi. This is like a very tricky question because yes, the caste system exists in India and it has been existing for years on, and to address the inequality that we have in the caste system, because again the lower caste were subjected to a lot of trauma and discrimination. They have some allotted seats in medical fields so that they are brought up and given like so around, if there are 200 seats, 50 seats might be allotted to them that only they can apply for. And where health professionals don't want to see treat patients from low caste, that doesn't happen usually. But if it does happen, it's like a really sad situation. But again, discrimination occurs, and the main idea is that medical field is one place at least where discrimination shouldn't occur. And if you feel that you have a choice to say yes or no to a patient, I really think you're in the wrong field, and you probably should change your field. That's it from my side.
Okay, so all the questions are done, but I have one question. How is the COVID situation in your country? How your country is dealing with it? If you know, if you don't know how it is working in your country, you don't need to answer. But that's for everyone. That one. That one. So okay. Okay. How is the COVID situation in your country, and how you dealing with it?
Oh, so for Taiwan, the COVID situation is not very serious compared to the world. So actually, we had noticed China had the COVID at a very early stage, like at January. So the town government had decided to close border at a very early stage, like for January or February. They decide not to allow citizens from China or Hong Kong or nearby cities to go into Taiwan. I think at the late February or early March, it starts to closed all its borders. So actually, no foreigners will be allowed to go into Taiwan. And people going back to the country have to have 14 days of quarantine, and people are wearing masks. As what Linda has mentioned, that the government has been distributing masks to the citizens and avoid that people are not having enough masks.
I would like to make some compliment about Taiwan situation of COVID-19, and because Taiwan have previous experience on how to control pandemic is in 2003 SARS. If someone can recall, maybe have learned about this, and actually my mother is from Vietnam, and I can also compare with the Vietnamese situation in COVID-19, and it has its border with China and it's also really close to China. And previously, Vietnam also have very good control of COVID-19 situation. They have less reports of patients than Taiwan. But nowadays, they have some people who just ran into Vietnam without the without being caught or something. And other things than distributing masks from the Taiwanese government, we also do really strict to control people of moving around the country with like some of our school without some of our schools just still have their courses online, but we can nowadays, just because the situation of COVID-19 has already just not so serious these days in Taiwan, so we can go back to school and the companies and the economics are just moving smoothly nowadays. And these few weeks have about 1 to 2 cases each day, and this already make our citizens very nervous. Just like this, it sounds very, it sounds a little bit ridiculous maybe to other countries, like maybe 1 or 2 people from other countries move back to Taiwan and they are positive for COVID-19, and we just feel, oh my god, what happens today? And Taiwanese people has not very how do I say that? Just they are not used to many people's outbreak, but they are very thankful for the government of their supervision or something. Okay, just that's it.
So for Thailand, the situation in Thailand now is quite normal. Just people wearing masks on the streets. It's just that, and we don't have any new cases in the country right now. The only new cases in the country are from abroad. So, but right now we still receive people from other countries by planes, and we also provide them with a place to stay for 14 days for quarantine for free, I think. And so I would like to say it's now your time for people out there who want to come to Thailand for an exchange. You can come now. It's still free. Okay.
India is still under lockdown and is still trying to manage. Intercity travel is prohibited unless in emergency. And everything is still under shutdown, but we still see people out there, luckily wearing masks. But yeah, India is still under a lockdown and the cases are increasing. I think we are 3rd ranked in the world for corona cases. So it's not such a good outlook, but let's hope.
Yes, thank you. That was the last questions for today. If you wanna add something to the final considerations, we're gonna have time for it, so feel free to do it now. Like whatever you wanna say or no.
Thank you so much for this wonderful talk that you had and this program that you that DENEM Brazil is doing. Like, it is really great. And thank you to the participants who are watching. I know you would have to wake up early because it is 8 p.m. here, but I know like Monica also woke up like super early. But thank you so much for the questions. It was a really great experience, and hats off, guys.
Thank you.
It's my first time here, so my first time talking online, really my first time. So I'm very nervous, and thank you all for like very kind and listen our presentation. I would like to invite all of you guys to come to Taiwan and visit here if there's an opportunity. It's a really good place here, and thank you very much for organizing this and inviting.
Yay, thank you so much, guys. Thank you for support our initiative. Thank you for being here. I don't know if it's late for you, but thank you for staying to the end with us. All presentations were really amazing. We love it. I'm sure our students love it too. So thank you for everything today. And that's it.
Bye
Bye,
bye.
guys.
Bye bye. Thank you very much.